right. Does it let you know when it's recording?
Good to go.
Good to go. Okay, great. All right, so good afternoon, and thank you for joining us for today's webinar, Managing Member Coverage. My name is Hannah Wicki, and I am the Director of Operations at the Wyoming Primary Care Association. We are pleased to feature a national and local perspective on this topic. Today's webinar features Everett Lebers, CEO of Point Care, and Nikki Oldham and Veronique Whaley of Bear Lake Community Health Centers. We touched on this topic at the Power of Rural in early June and wanted to provide this webinar to take a deeper dive into how establishing an enrollment department and their activities are beneficial for both healthcare organizations and their patients. There will be time for Q&A following today's presentation. Please enter questions into the chat box. Attendees will be muted for the duration of the webinar. And if you have any technical issues, please enter those into the chat box as well. Finally, please complete, could you switch to the next slide? Next slide. Sorry about that, technical, there we go. So just to show you, where it sits on the menu, we're asking that you select the chat box and then enter the question there. Your menu will disappear, so you need to hover over it in order to bring it up, and that's where it will be located. So with that, sorry, got off track. Finally, please complete the evaluation that will be sent out after today's webinar. This helps the WYPCA in planning future trainings. I'll now turn it over to Jennifer Haggerty at Point Care.
Thank you so much for having us. We're excited to be part of this. We're excited to be invited by the Wyoming Primary Care Association. As mentioned, we were out for your annual conference in June, and this is kind of the second phase to that. So just wanted to introduce the team members that we have on today's call. My name is Jennifer Haggerty, and I'm the Regional Vice President of Sales here. So I've had the pleasure of possibly speaking with some of you at the conference. I attend a lot of associations, NAC conferences, things like that. Also joined by Everett Lebers. He's our co-founder and CEO.
Good afternoon, everyone. Thank you so much for having us.
And we're really honored to be co-presenting this with Bear Lake. They are really the knowledge, the feet on the streets, and having that local perspective there in Wyoming and a few other states. So Nikki Oldham, who's the Business Operations Director from Bear Lake, is joining us as well.
Hi, thank you for having me.
And then Veronique Whaley, who's the Marketing and Outreach Specialist at Bear Lake.
Hi, thank you for having us.
So we're going to go ahead and kick it off and get started. I'm going to let Everett Lebers take over.
All right, thank you very much, Jen, and thank you, Hannah, and the Wyoming PCA for allowing us to share a little bit of our experience on this topic. A little bit about Point Care. We were founded in 2012. We actually started as a nonprofit back in 2004, in which we sought out to kind of organize all the different ways to obtain public and private health coverage and really centralize that capability. When we learned that health systems really needed this capability, we started Point Care in 2012 and started working with FQHCs in 2013, actually. And as we've done that, we've really started to learn that the problem that FQHCs face is that 5% or 3.8 million Medicaid members fall out of coverage every single month. We'll talk a little bit more about that. And because of that, our mission is really to enable health systems to discover, secure, and help manage some of these private and public coverage options for their members. And it's our passion to create really a no barriers approach to healthcare, which we feel is really in line with FQHCs. The majority of our clients are FQHCs. So what are we going to be talking about today, and what are the learning objectives? Number one is really understanding the enrollment cycle, which is the process of enrolling someone into a various type of coverage, let's say Medicaid, for instance. Next will be how to evaluate this enrollment cycle within your FQHC. And then finally, connecting the annual patient value to coverage.
So talking specifically about the enrollment cycle, Bear Lake, what challenges do you face as a clinic when facilitating the enrollment cycle and managing that coverage for your patients?
Yeah, for us, probably one of the most difficult things has to be just tracking and following up on the cases that we're working on. It's very manual and labor intensive, so it's very difficult for our team to stay on top of every case without things falling through the cracks. And just some examples would include, just getting certain documentations back from patients on time to turn in so their Medicaid doesn't close, or they won't lose premium tax credits if they don't turn something in on time. So things like that has been very difficult for us.
Yeah, and we see that time and time again in FQs across the country. While the process exists, there's really been not a huge effort in streamlining that from a technical standpoint. And let's talk a little bit about the programs that are available to Wyoming. This may come as a surprise to a lot of you on the line today, as it often does when we share this type of data. But Wyoming has over 45 programs available to your patients, really, varying between public programs like Medicaid and Kid Care and SSI and Vaccines for Children, et cetera, to the private plans, of course, healthcare.gov, subsidized individual plans. And then also there's a lot of additional benefits that can help the patients in your community. One, for instance, is like LIHEAP, which provides an energy assistance program, which can help them with some of their monthly costs. SNAP, of course, food stamps. There's a lot of these programs that exist, and it can be quite overwhelming to manage these. Here at Point Care, what we do is we have an internal team that is staying on top of all of these programs, not just for Wyoming, but nationally, down to the zip code, keeping up all of the eligibility requirements, the sign-up checklist, the contact information, applications, everything, so that our customers don't have to manage that. Let's talk a little bit about Wyoming and what your demographic kind of looks like today. So the total population in Wyoming is 571,000, small in comparison to a lot of other states, with 13% of that population being covered by Medicaid, which is approximately 75,000 individuals in Wyoming. And 31% of them are lower income, so even more than 75,000 will qualify for some of those subsidized individual plans. I want to talk about the idea of coverage management, and this has been kind of fascinating for us because we've been kind of blazing the trail on this effort of coverage management, because what it really means is tracking and preventing lapses in your members' coverage. And with the right data and the right management platform, your uninsured patients can become covered members and stay that way. And what we've learned working specifically with FQHCs nationally and the members that they serve is that ultimately the members don't have any coverage representation once they are covered. They're asked to work directly with Medicaid or the MCO, and oftentimes that's why they fall out of coverage so frequently, is that they either don't renew or the state just drops them. And so we've kind of identified and been working with FQHCs in the aspect of them being the representatives for their members. And if you're organized and you have some automation in place, it's actually quite simple to stay on top of kind of your entire population's coverage.
When it comes to coverage management from a clinic perspective, what is your ideal outcome, Bear Lake, for actively managing members' coverage?
So of course we want to find the best coverage options for patients that will help reduce their financial burdens. We want to identify more Medicaid eligible patients. This will help them find better outcomes. They can go to hospitals, they can go to referrals. The slide is very limited, and so it will allow patients to have, like I said, better outcomes. They can, really take care of their health issues.
Yeah, and you know, Slide is definitely an option, and what we've learned is that a lot of the folks on Slide do actually qualify for Medicaid, but it's not to say that Slide doesn't serve a terrific purpose, but it also requires its own unique way of management as well. So like, why is it so necessary to manage coverage? And this is where I want to get into some of the data that we've gained from FQHCs nationally. So we have some products that will show them who falls out of coverage on a monthly basis. And what it shows time and time again, regardless of the state, the county, or the size of the clinic, is that 5% of their patients fall out of coverage every single month. In Wyoming, that equates to about 3,800 patients every single month that drop from coverage. And people will ask, why do they drop? Oftentimes it's because, again, they have no representation. They don't know that they're supposed to renew. Medicaid isn't doing a good job, obviously, of keeping people up to date. Other reasons is that their eligibility changed, or in some cases, they just get dropped from coverage. A lot of clinics will agree to the fact that patients got approved less than a year ago, and maybe even just a few months ago, and they come back in and they're not covered anymore. So that's really why this is necessary. And when you look at the annual patient value of a Medicaid patient at an FQHC being between $550 and $750, this is the annual patient value of a covered member, right? Because that PPS rate's astronomically higher than that Slide. And if you can keep them covered, they're still going to be coming in whether they're covered or not. You might as well try to get the maximum value out of them from Medicaid. And a big reason why all of these patients are falling out of coverage is because this is kind of what the landscape looks like today. We like to call it the current state, where a Medicaid member will come into your health system and you have a relationship. You have a bidirectional communication. You're working with them, they're working with you, you're giving them care, you're helping them get covered. There's a good relationship there. But when you submit that application to Medicaid, it's unidirectional. Medicaid's not talking back to you. And this issue is extrapolated when the member is seeing more than one health system, which is often the case. So you have multiple health systems or even multiple locations within your FQHC trying to get this person enrolled over and over again. And it's not the greatest member experience. And all that stuff goes to Medicaid. And what does Medicaid do? They bypass the health system and go back to the member directly with either requirements or saying that they got approved. And what this results in really is kind of this epidemic of uninsured patients that visit your FQHC constantly. But what we've learned is that most of them qualify for reimbursable programs.
Really quick, looking at the current state and some of those bottlenecks and challenges, what bottlenecks can you identify when qualifying, enrolling, and managing coverage across locations and staff?
Yeah, I think for us, we're kind of in a unique situation where we have clinics in 3 different states, and that means 7 different clinics, 3 different states with different rules. So it's very difficult to really train and educate all of our staff members to kind of have the same benchmark on the type of knowledge they need to ensure that they know about the different programs and the qualifications that are needed. So with that, we were having different staff members just creating a lot of mistakes, and also just a lack of knowledge of what's available in the different states. Like you guys kind of pointed out earlier, there was a huge list of all the different programs in Wyoming that even we were unaware of. So just knowing about all of those programs as well. And previously, our Slide department, our Medicaid department, our Marketplace department were all separated. They weren't integrated together as an enrollment department. So, so the lack of integration was a bottleneck for us as well.
There's a lot of moving parts, to be sure. And when it comes down to it, knowing where to begin is always the best start. When we look at how many of these patients actually do qualify for programs, we decided to analyze the data, and we looked at over 235,000 uninsured patient screens over a 12-month period. What does that mean? These are customers that are using Point Care Qualify to identify which coverage options are necessary to enroll in for a particular member based on some questions that they respond to. What we learned is that most qualify for Medicaid and are not being enrolled. In fact, In expanded states, 81% of the patients that were screened qualify for Medicaid. In non-expanded states, it's actually much higher than I thought at 50%. So a lot of these folks are oftentimes being defaulted to sliding fee, when in fact they could be on Medicaid. So we ask you, who is responsible for managing coverage? The answer is simple, and that's really the enrollment department in your organization, often called the eligibility team or the member services team, kind of different names. We like to refer to that as the enrollment department. And what are they, and what should you be asking of your enrollment department, right? So what we've learned is the ownership of that enrollment process is often owned by one person, and there's not a lot of familiarity around the data or transparency around that. So what we want to offer to you is just some questions or some data points that you can ask of your enrollment team. First being, what percentage of the patients are qualifying for Medicaid? Meaning they don't have coverage, and after asking them some questions, you believe that, yes, you should enroll them in Medicaid. What's that percentage? Well, how many of the uninsured patients should be getting enrolled? From there, how many got submitted? Meaning they did qualify, and then you took an application and submitted it to Medicaid. How many got approved, right? These are really important metrics to understand as a manager and an executive. How many got anchored? How many got anchored? This is a term that has been kind of coined by a lot of our clinics as we worked with them, because it's kind of a newer concept. But like, once they got approved, did they choose your health system as their primary care provider before getting auto-assigned? Another important data point to know. How many renewed their coverage? And finally, show me the data. What kind of reports do we have?
You know, talking about all of this really key information that clinics really should have access to in gathering and collecting, you know, how do you feel a systems-based approach helps with that data and reporting? I didn't catch that. Sorry.
So our current process that, you know, as we were looking at it, we realized was very time consuming and costly. There was always errors happening. So as Everett had pointed out, with a systems-based approach, we're able to be more organized, we're able to be accurate, and everything would be at our fingertips.
So let's dig into some of the data that is being shared and discussed around the country today. We really like to take the approach of like, what will you see your team working on? Because it's different. Every clinic's different. And so this clinic, for instance, this is Central Virginia Health System. They serve about 7,000 Medicaid patients annually, and these are their quarterly results. So what did they see? They saw and continue to see an increased payer mix and a stronger management of Medicaid enrollments. So if we look at these numbers here, 204 members enrolled into Medicaid in the past quarter. With an annual patient value of $525, which is what it is for them, they created over $100,000 of value by getting these patients covered in the last quarter. They're also focusing on healthcare.gov. You can start to see what your team's really enrolling their patients on. This clinic is called Mission East Dallas. They're a rural FQHC. They only serve 400 Medicaid patients annually. Okay, so very small. What do they see? They actually see better management, documentation, and reporting for sliding fee patients. So their effort actually has been more towards the slide, where their Medicaid enrollments have been pretty low. And so they can start to understand what's happening in the organization and how they're using it. This is Vista Community Clinic, a larger FQHC. They serve 37,000 Medicaid patients annually, and these are their quarterly results. What do they see? Expanded programs, community education, and social determinants of health. So you can see they're really enrolling people in CalWORKs, CalFresh. They're helping them with the renewals. And and helping with some of these additional benefits that aren't specifically health coverage programs. In addition, they see a much stronger renewal and redetermination management to include more Medicaid. So look at all these renewal programs that they're working on. The total programs are over 1,000 Medicaid for what this group's working on. To include some of these numbers over here. So it's really interesting to be able to understand what's happening and then take appropriate steps thereafter.
We found, unfortunately, clinics just don't have the resources or the tools to capture a lot of this information. What decisions would change from a management perspective if you had access to this kind of data?
I think our hiring decisions, we're not requiring as many people because they wouldn't need to be doing things manually. The other thing I think that's important is we're able to reallocate our funds. As a community health center, it's good to have a healthy mix of uninsured, private pay, Medicaid, Medicare, commercial insurances. We don't want to have all of our eggs in one basket, which is good for us to be able to tap into other revenue streams.
It's funny that you mentioned the staffing thing, because what we've learned from clinics is that yes, you actually don't need to add staff as you grow as quickly as you may have in the past, because you can do more with the people that you have. In addition, if the team's overstaffed, you can reallocate those resources elsewhere in your clinic. And then also, as just natural attrition happens, as time goes on, clinics aren't finding the need to have to really replace that staff as quickly as maybe they would in the past. So what we want to talk about next is how to evaluate your current enrollment cycle. It's kind of like, where do you begin? We talked a little bit about the data that you want to ask from your enrollment team, but let's kind of visualize what today's process looks like. So we call it the enrollment cycle. First, you're going to identify that uninsured patient. Next, today, there's a manual qualification of that patient. What does that mean? Oftentimes, your staff will try to understand if that patient is a good candidate to enroll into Medicaid. Sometimes they'll look at the subsidized individual plans, healthcare.gov, but they're not really looking at these other programs. It's oftentimes just looking at those two, and it's not really data driven. From there, you're going to manage the application and submit that application, let's say, to Medicaid. And all that's really managed on spreadsheets. This is really our what we aim to eliminate, our spreadsheets, and we're doing that successfully. And because they're all done on spreadsheets and each person has their own, or each location has their own, the reporting is very manual. So oftentimes it takes some time to get the reports up to the management team, and they're inconsistent. And what that really results in is unmanaged coverage for the members.
Taking a look at the enrollment cycle, do you feel that this is a valid representation of Bear Lake's enrollment cycle today, or a typical clinic?
Yeah, this is exactly what we're seeing right now with our current process. It's very manual. It's very time consuming to kind of backtrack and try to create those manual reports. So yeah, you hit it pretty spot on.
All right. And the only reason we have been able to visualize this in such a condensed amount is because this is what we've been told every time we've talked to an FQHC. So where do you begin? Here are some evaluation questions you can start to ask. And I'd suggest maybe taking a screenshot of this, but also you'll have access to this webinar afterwards. First, do we have enrollment managers responsible for enrolling patients? This is really the beginning. And most clinics have one, but we recommend having at least one dedicated to this effort. And then the data will show you if you need to hire more or not. How many patients qualify, submit, and get approved monthly? If you have an enrollment team, they should be able to give you these answers. How reliable is this data? Is it spreadsheet or systems based? other good questions that management executives can ask of their team. What is our process for actively anchoring patients? Okay, so we have a process, we have an enrollment team, but what happens once the patient gets approved? Do we even know if they get approved? And are they choosing us? Meaning, did we give them a nice member experience to make them want to come back? What is our process for redetermining member coverage? Are we actively helping our members understand their redetermination dates to stay covered? Or are we just re-enrolling them over and over again at point of care? And this is a big one. What happens if an enrollment manager or an enroller leaves the organization? Does the process go with them? Do you have to start over? Who do you have to hire to replace them? And what kind of experience do they have to have? Does that experience even exist in the market today? So let's look a little bit at the enrollment cycle today. Again, this is the manual process. However, if you're using technology and you start to automate that, after you've identified that uninsured patient, you now can automatically qualify that patient for all coverage options. You're still going to manage that application. You're still going to submit that application, but you're doing it in a system that allows for consistency across staff and location, transparency to management and executives, and my personal favorite as an owner of a company, transferability, which is, can I pass this process off to the next person without patients and members and communication and reporting falling through the cracks? And what that really results in is automatic reports that are able to be read and interpreted, and insights can be gained from them, and actions can be taken so that you can ultimately manage coverage for your population today. And really, that's what we call the enrollment cycle simplified. So at a high level, what are some expected outcomes you should see? Number one, high quality data that's usable is the key. You're going to end up with a much more pleasant patient experience, as your organization will be all on the same page around that member's coverage. And if they're in the middle of an application process, or if there's been an application that's submitted, just overall a really nice patient experience. Systematic member management for coverage, that really doesn't exist in the market or in the space today, from what we've seen. And perhaps the bottom line for your financial position is that you're going to end up with more covered lives and more revenue for your organization.
So we always like to have a clinic perspective on this. And, Bear Lake, what is your vision for managing coverage in the long run? What do you guys see happening?
So our biggest goal is just to raise the bar, the level of care for our patients, helping them find the best coverage possible for them. Our old system in the past was just an endless cycle. We realized that it created actual barriers for patients in seeing if they qualified for the slide or Medicaid or even Marketplace. We want to meet their expectations and help them navigate through their coverage more seamlessly. And lastly, we want to educate the patient and the community, as well as our staff, which Veronique will go into a little more detail about that later on. But just really helping them, understand that Medicaid really isn't a bad thing, and it's there to help them.
That's great. You guys are very forward thinking in that, and we appreciate that. And I know you've talked a lot about your enrollment department in the past, but what is kind of the next steps that Bear Lake is taking in the implementation of your enrollment department?
So we've created a new enrollment department due to the bottlenecks that we've had. We've recently hired 2 new enrollment advocates, and we're in the process of hiring more in that department. Our existing personnel who were helping with the slides were also employees that had other duties. So we're relieving them of those duties so they can focus on their main duty, such as receptionist or clinic manager. We've also added a new office space for our enrollment advocates and our Medicaid eligibility worker that we have for the state of Utah. It's been very nice to have the 2 departments together. And then Also, we had a lack of space for patients to meet with them.
Yeah, and also with being so widespread, we've really tapped into telehealth, and we're really utilizing our video conferencing technology to meet with patients that are in outlying areas, especially in Wyoming with Rock Springs and Edison. They're very just really spread out, so patients really appreciate that. We've also implemented a pre-screening process, so every call that comes in for an appointment will be directed to the enrollment advocates, whether they're uninsured, uninsured. We also plan on using Point Care as a system to help us track and manage the coverage for our patients. This will really help us reduce the amount of employees we have to hire, identify and increase revenue, and help reduce human error. And one of our other goals is to really kind of have a big turnaround for our whole organization. We would really like our enrollment department to work more closely with our different departments, such as the patient outreach coordinators, the clinical staff, the billing department. So that way it's really a team effort in ensuring that our patients are getting the best coverage they can receive.
You know, it sounds like you guys are really making investments to grow that side of the organization. And I think that the data is pretty straightforward with regards to what that return on investment will look like. You know, it's pretty simple. Just cover more members, get more PPS rates, offer a better patient experience, and you'll end up with more patients that are choosing your organization. So hats off to you guys. I really appreciate you taking the time today. You've done a terrific job. If anyone is interested in evaluating your enrollment cycle, just contact Jennifer at the email here on the screen, or hop over to pointcare.com, and we'll be happy to kind of take you through this and get you up to speed with a lot of the FQHCs are doing today in the industry.
Great. Well, thank you so much for that presentation. So this brings us to our Q&A section, and I see that so far we don't have any questions submitted through the chat, but I had a couple of questions that I had burning as we were going through the presentation, and there's still time to submit questions, so please feel free to enter those questions into the chat box. So first, I had a question for you, Everett. You had mentioned briefly about anchoring patients to your health center after you complete the enrollment process. Do you have any best practices that you've witnessed that you could share with the group?
Yeah, absolutely. So once you have a process in place to identify when a patient is approved, oftentimes you're going to know this before the patient if you set your process up correctly, and something that we help customers do. But the idea of having a patient choose you as their primary care provider begins with offering them a pleasant enrollment cycle, a pleasant patient experience throughout this enrollment cycle. So simply asking a patient to choose you as a primary care provider isn't enough. You have to have a great experience leading into that. And then when you reach out to them and let them know, hey, Jane Doe, we've got good news. We got you approved for Medicaid. How would you like us to help you choose a primary care provider? And, obviously asking them in a way that is not, saying, hey, pick us, but helping them and guide them through that process. It'll be the first time they ever got called from an FQHC with that type of news. Like, wow, these guys are really on it. Like, they're actually helping me, representing my coverage. This is something that I want more of. And then odds are they're going to choose you. So it's the kind of the last piece in what is, the total enrollment cycle. But what makes it really easy is giving a nice, pleasant experience up to that point.
Great, thank you. And then we've got a question in the chat box. Does Bear Lake separate out the scheduling responsibility from the enrollment responsibility, or do the same staff do both?
No, we have separate departments, so all calls come into our patient outreach or our patient coordinators, and they will transfer the call and kind of take ownership of every single call that's coming in. And the enrollment department just does the enrollment cycle.
Great. And then I have another question. So this is for Bear Lake. I was really interested in the remote intakes that you're able to do, and that you're looking to continue with your enrollment department. Can you please run us through the workflow of how Bear Lake will execute a remote intake with the enrollment department? And then can you start with how you will identify the patient to receive the intake and go from there?
Yeah, so it kind of all really stems from our patient outreach coordinator department. So what their role is they're kind of the call hub of our organization. They do all the scheduling. They also have a provider that they work with. So it's really from there. They are the ones identifying who's uninsured, underinsured, no insurance, high deductibles, things like that. And then they will redirect the call to the enrollment department, which is us. So the call will get transferred over to us. And then from there, we do a screening process over the phone. This really kind of helps eliminate them coming in to meet with us for an appointment, and then we find out that their situation's different from what we thought, and that way we just can really eliminate a lot of things and be more effective with the time that we have. So once we pre-screen them over the phone, we can easily identify whether they qualify for Medicaid, for the slide, Marketplace, by asking them some screener questions. And then from there, we'll set up appointments to meet with them to fill out those applications. So that's from the point of view of calls are coming in. There's also kind of the other side of patients that kind of just show up to the clinic, or they're already existing patients and maybe for some reason they fell through the crack of the POCs, the patient outreach coordinators. So it's the receptionist and the medical assistants and the nursing staff and providers' responsibility to really get them to our department. So they'll call us up and say, hey, I have this patient who's uninsured. And if we're available, we'll actually talk to them right after their appointment. Since we are covering 3 different states, that's where we're tapping into our telehealth. We have a TV screen where we can actually meet with the patient right after their appointment and do a screening process from there. And then after that, we'll schedule an appointment to meet with them, and whether it's Medicaid, Marketplace, or fill out a slide application.
Great, thank you.
Yeah, and do you mind if I just add a little piece to that? Because that's like a really nice workflow to have that pre-screening over the phone in advance of that appointment, and to just touch on your fact that you said that it's going to eliminate kind of that whole initial appointment where you're finding out if they're qualified and stuff. One of the features that you're going to have with PointCure is that should they qualify after you do that screening, you can text them a list of all the programs that they qualified for, along with all of the documents that are needed. So they can bring that in on that first visit, as opposed to having to go back and forth between visits to collect that stuff. So I just wanted to throw that out there because I think that's a key part of that process, which is the communication of what coverage they qualify for and subsequent documents needed to bring in to get enrolled.
Great, thank you for elaborating on that. So we don't have any additional questions submitted to the chat box. I'm going to do last call. Anybody have any questions that they would like to pose to any of our presenters? All right. Well, this webinar has been recorded, and I would like to thank everybody that was able to join us today for the webinar. We'll be sending out the webinar recording to all registrants, and then it'll also be available on the WYPCA website. Please fill out your evaluations, as it truly helps guide our efforts in terms of training and TA that we provide in the future. Thank you, everyone. Have a great day.